Bismillahirrahmanirrahim. I'm Dr. Shiruli Khan, Senior Demonstrator, Community Medicine. Our topic is child abuse. What is child abuse? Child abuse occurs when a parent, guardian, or caregiver mistreats or neglects a child, resulting in injury, significant emotional or psychological harm, serious risk of harm to the child. Child abuse entails the betrayal of caregivers' position of trust and authority over a child. It can take many different forms. Signs and symptoms of abused child. You will see bruises all over the body, mostly. There would be multiple fractures. Joints would be swollen. You will observe burns and scars on the body. Abrasions and lacerations would be there. Hemorrhages are also noted. Mostly they are subdural or retinal. There would be damage to the different organs of the body. And you will also see repeated history of poisoning. There would be failure to thrive. Failure to thrive means that the baby will not gain weight. He or she will be generally too weak. You may see them in coma or in unconscious condition. These things may lead to death. There are many different forms of physical abuse, but mostly skin, mouth, and bone injuries are noted. These are most common. There are three components of child abuse. A child should be there and a caregiver. Caregiver, parents or guardian will be having they are depressed, they will be in stress, and these components or these factors lead to child abuse. Factors responsible for child abuse are factors predisposing to child abuse. The causes are not known exactly, but there may be parental characteristics or parental guardians behaviors, characteristics of child. Environmental factors are environmental characteristics. Let's see what are these. Child. The child may be emotional. They may have behavioral difficulties. Mostly they are suffering from some chronic diseases. They are having physical disabilities mostly. They are globally delayed or they are having developmental disabilities. The babies may be preterm or they are unwanted babies. Parental characteristics or parental factors responsible for child abuse. Low self esteem, poor impulse control, they may be addicted. The parents or caregiver may be too young. Abused is a child. They are mostly depressed. They are having poor knowledge of child development or unrealistic expectations for child. They are having negative perceptions of normal child behavior. There are some environmental factors which may lead to child abuse. Social isolation, poverty, low educational achievements, single parent home, non biologically related male living in home, family or intimate partner violence. There are different types of child abuse. It may be emotional abuse, neglect, physical abuse, family violence, sexual abuse. Types of neglect. It may be emotional, educational, or newborns addicted or exposed to drug. Emotional neglect. The caregiver fails to meet the child need for attention and affection. Educational neglect. The parents or the caregiver don't attend to the educational needs of the child. Newborns may be exposed to drugs, some drugs due to the mother use of drugs during the pregnancy. The child is born addicted or exposed to drug. Treatment. Treatment is mostly symptomatic. The treatment should be provided whichever part of the body is affected, that should be treated. It is called symptomatic treatment. Appropriate medical, surgical, and psychiatric treatment should be started. The law requires that a child suspected of being abused or neglected be reported urgently to Child Protective Services if these services are available. Suspected abused child should not be discharged from the clinic or the hospital without consulting the country Child Protective Services. Hospitals should have a team of professionals which include pediatrician, a hospital social worker, pediatric nurse, and a psychologist. These are expert and they are trained and they are skilled in child abuse recognition. And the child should be provided symptomatic treatment. Thanks.